One single patient admitted to the emergency ward at Durban's St Augustine's Hospital at the start of the COVID epidemic led to at least 135 infections. So what lessons can we learn from this? Investigators who probed the incident there have warned that South Africa could see a spike in healthcare worker deaths if hospitals fail to enforce strict controls. Mia Malan from the Bekisisa Centre for Health Journalism has more on the investigators' report. She joins us now. Mia, good evening to you. This investigative report, it was recently published. What lessons can we learn about how these infections spread so quickly at this one hospital?
So what we could learn is that the coronavirus spreads extremely easy in hospitals, and that if we don't implement strict infection control measures in our hospitals really fast, we could end up with a disaster in health worker infections and deaths. So in short, what happened, as you've mentioned, is that one infected patient admitted to the hospital's emergency ward led to 135 other infections within the hospital and a nursing home within a really short period. And of that number, 2/3 of the infections were health workers. Now, the report shows that the main way in which the virus was transmitted was from droplets transferred from surfaces by the health workers. And the reason is because the health workers didn't wash their hands often enough. If they had, some of those infections would have been prevented. So the first lesson is a simple one. We need to find ways to get doctors and nurses to wash their hands more often. And the other lesson has to do with how we organize patients within hospitals. So one of the other main ways in which the virus spread at St Augustine's was when staff moved patients around between wards without knowing they were infected. And they moved them around because they were preparing for they were making space for an influx of COVID-19 patients. But meanwhile, the virus was already there. So to fix that, the researchers recommend that hospitals set up a color-coded system for entry and admission to facilities. That has worked very well in Taiwan. It's led to almost no infections within such hospitals. And that system needs to separate patients who have COVID-19 from those who don't have it, from those who might have it, and you can't move them around among those zones. But it's, of course, a lot easier said than done because our hospitals may require quite a few structural changes.
It might require structural changes, but I mean, this was at the early days of the pandemic. Could hospitals make that sort of mistake? Could it happen again? Or do you think a lot's changed in our hospitals since then?
Well, what this report showed us that if we don't implement special, extra, really stringent infection control measures, it could happen again. So that is why we need to take the lessons of this report really, really seriously to implement in other hospitals. We've seen outbreaks in other hospitals that have made similar mistakes. And if we don't take these lessons and implement them in a very methodological kind of way, we are likely to see more infections indeed.
Okay, there are a lot of lessons here that will help government, that will help us in hospitals going forward. There's also a conversation around the NHI, which really was a big conversation in society before COVID-19. Do you think everything that we're seeing now, and certainly a lot more cooperation between the government sector and private sector hospitals, is that going to make it easier to implement NHI? Or could we find that the health system actually just completely loses capacity as a result of COVID-19?
Well, it could go either way. It of course depends on how well we implement those new systems. So, for instance, studies show us that South Africa's hospitals have a really limited capacity to isolate infectious patients. So if we could improve that capacity with systems such as those recommended by St Augustine's, it could help us. But we can look beyond St Augustine's. Just last week, the Labour Department ordered Freya Hospital in Besho in the Eastern Cape to shut down because it said Freya is likely to threaten the safety of patients. Now, that's not new. The good thing about a statement like that is that the need to treat COVID patients has highlighted the state of the hospital. Activists have been complaining about that hospital for what must have been 2 decades, and nothing has been done about it. So what will now determine if there will be a lasting benefit is whether COVID-19 will lead to the health department reacting in a more urgent way, and whether their actions will be monitored in a much stricter way than previously, so that the improvements that are made are hopefully more tangible and sustainable than what has been done in the past.
Certainly something that's surely going to change here and in other countries is the respect in which we hold healthcare workers. We have millions, billions of people around the world celebrating them once a week, every night at the moment. And that suggests that the way that we feel about nurses and doctors is changing.
I think we're more aware of health workers. I think we are recognizing what they do. It's more on the news. It's more around us. We realize that our lives are going to depend on them. I think we also are more aware of their needs when it comes to protective equipment, when it comes to working hours, and particularly when it comes to the mental health that they're going to experience during this time when they have to make really hard decisions on who's going to get an ICU bed and who's going to get a ventilator when there's not enough of that.